Hello, I'm Dr. Eun in Bumin Hospital, Seoul, South Korea. Today, I will talk about spine and lumbar disc herniation. I see many patients who suffer from disc herniation, and I also have lumbar disc herniation. What happened? My disc healed and no pain at all. 5 years ago, I played golf and I had popping feeling at my back. Next morning, my right side buttock ached. Radiating pain persisted for several days. I took MRI and found annular tear and small disc herniation. After a month, radiating pain disappeared. Recent MRI showed absorption of herniated disc. I will tell how I manage my disc herniation and get healed. People hear about disc herniation but don't know about causes and right management. And today I will explain what is disc herniation and how to recover. Disc is structure between vertebral body. It absorbs shock and gives movement of spine. Outer annulus tears and inside disc herniates outside. Herniated disc fragment compresses spinal nerve. You may have questions like my back hurts, but I'm not sure whether this is disc symptom. Back pain disappears with time. Do I have to visit hospital? When you have back pain, it does not mean that you have lumbar disc herniation. It can be muscle strain or spine arthritis. Spinal nerve compression causes pain, numbness, or weaknesses of lower leg. Shooting pain from buttock to leg is called radiating pain. Back and leg pain means discompression of spinal nerve. Your leg becomes numb or painful. When disc is torn, only back pain occurs. Pain is provoked with sitting or getting up. It's difficult to bend spine and sometimes you can get out of bed because of pain. When herniated disc compresses nerve, leg pain occurs. Electricity runs from hip, thigh, calf to foot. Numbness and feeling like something is stuck on your feet is one of these symptoms. In most severe case, weakness occurs. You can't move ankle or toe. You may limp while you walk. In worst case, it affects urination and anal sphincter. Okay, then why disc herniation occurs? Most common causes are aging and overuse. Usually, bending spine motion damages disc. Working with bending position and lifting heavy objects are bad for your spine. Driving a car for a long time also creates back pain. Sitting in a car seat is similar position as bending spine and gives a lot of pressure on disc. One has to keep posture with stress and muscle pain is added. Other causes for disc herniation is congenital. Usually, young patient who is not involved with heavy labor is classified to congenitally vulnerable disc. Usually, people think back muscle strengthening exercise can prevent and treat lumbar disc herniation. Of course, strengthening back muscle is an effective way of prevention. But wrong exercise when you already have disc herniation can be a disaster. Principle is protect your disc first and then do exercise. You should avoid lifting heavy object, working with bend position, sitting for a long time. There are many exercises on YouTube, but you can't figure out which one is really good. I have written 2 books and introduced many exercises, but today I will tell 3 most effective exercises for lumbar disc herniation. But before, I will tell about not to do exercise. All exercise with bending motion like sit-up are bad. Bending spine creates stress on posterior part of disc and increases pressure on front side, and it aggravates disc herniation. One should lift object not with bent back, but straightened back with knee extension. Number 1 exercise for back is McKenzie extension exercise. McKenzie extension exercise decreases pressure on posterior annulus. We mostly do bending movement in daily life. Therefore, in reverse, extension exercise is recommended. Lie down and lift body with elbow on floor. If it is okay, lift body higher by extending elbow. Number 2 exercise is bridge exercise. Lie on floor and bend knee. Lift pelvis to straighten body. Without bending movement, we can train our body's biggest muscle like back, pelvis, and thigh. At last, third best exercise for back is walking. While walking, spine keeps straightened position without bending or twisting. Shock created during walking stimulates disc and makes it healthy. Weight reduction, lowering body glucose, increasing heart function, preventing other disease, and giving better mood. Walking is best exercise for many reasons. Every exercise should be done regularly to show effect. Walking is good and easy to keep in your routine exercise. Please walk every day for at least 30 minutes. Until now, I talked about causes and prevention of lumbar disc herniation. Now I will discuss about treatment. Surgery is last option for treatment of disc herniation when patient present with weakness or severe pain. Surgery removes disc fragment, but torn disc healed by itself, and spontaneous absorption of protruded disc is possible. Conservative treatment is very effective in disc treatment, so that medication, spinal nerve block, epidural neuroplasty, and surgery are tried step by step. At last, when surgery is needed, we seek for minimal invasive way of treating disc like spinal endoscope. Okay, we have studied about lumbar disc herniation. Lumbar disc disease can happen to anyone. We should avoid bad posture for spine, and McKenzie extension exercise, bridge exercise, and walking can keep you away from lumbar disc herniation. Thanks for watching. I'm Dr. Eun in Bumin Hospital, Seoul, South Korea.